In this video, we're going to demonstrate how to make a one-handed composite box. The one-handed composite box is the key to being able to quickly and efficiently utilize more than one shade of composite, or to cleanly use less than a full compule of composite on one patient. To make our box, we're going to use a Pelican 1020 micro case in black. We're going to use a piece of 5mm or 4mm line, and I've pre-shrunk a piece of shrink wrap over the line. That way we're not going to be contaminating it. So the shrink wrap is going to be part of a loop that's for our thumb, and it will be something that can be wiped down. Inside the box we're going to put a poly pad 3 by 3 inches and a bonding agent receptacle. The Pelican case is made to be waterproof, and for our purposes that's irrelevant. So we're going to modify the case to make it usable for our dental assistant with one hand, and we're going to make it so it doesn't latch and doesn't spring. I've pre-drilled 2 holes. The holes are going to be used to create a thumb hold, and we'll put that together in just a minute. As it is now, though, the box top is sprung, and it's sprung to create that seal for a watertight situation, and we're going to solve that by getting rid of the little rubber liner. We don't need that. And then we're going to disconnect the latch, because we also don't need it to be latched. And to do that, we can take any kind of a knife or instrument, and we can walk the little metal posts out of the ends, get them started, and just kind of ooch them over until you can grab them either with a hemostat or a pair of pliers. I'm doing this tape at home, not at my office, so I'm going to use a pair of pliers. And we're going to remove both pins. And get rid of the handle. So if we want to trim away some of these excess little pieces, we can do that, but it doesn't matter. Now the box easily hinges and fully closes. Next, having already drilled 2, in my case 11/64 holes, just below the Pelican symbol, and just on the outside of the ribs, we're going to take our line and pass it through the holes into the box. And we get a glimpse of what's going to happen here. We're going to have a box where we can stick our thumb through and open the top with one hand. I'm going to knot the insides and seal them up, and then show you what that looks like. Okay, we've now taken our box and attached our thumb loop. The thumb loop is a piece of 3/16 or smaller line and heat shrink tubing. The heat shrink tubing in this example is 2.5 inches long, and the line was 8.5 inches long. We open the box up, and with a little extra lighting we can see that the line loops around and is knotted with a square knot, and then the ends are burned carefully off so that it's clean. We can now add our paper pad, 3 by 3 paper pad, and some type of receptacle for the bonding agent. It's good to have at least 2 wells. If you're using self-etching, self-priming bonding agent like Scotch Bond Universal, for example, you'll put that in one well, but if you're wetting your instrument at all with any bonding resin, you do not want to use the self-etching products. You'll want to use unfilled resin, and a drop of that might go in a separate well. So if we're working with 2 shades of composite, we might have A1 and maybe A3 composite. A small amount can be put out, and just as on a palette, the assistant can be holding the box so it's light tight. There's no polymerization going on, and he or she can open the box right over the patient's chest in front of you so that you can grab your IPC or your condenser or whatever your favorite instrument is, grab a little bit of the composite, put it in the tooth, box gets closed, the assistant can be using the other hand to suction. So one-handed operation and you're good to go. The box is the secret to being able to efficiently do more than one shade of composite or more than one material. Lastly, if you buy a Pelican box and you do this little project and the hinges are tight, give it a little spray with some dry lubricant and work it a few times and it'll open and close just as I demonstrated. Once you can have 1 or 2 or 3, however many shades of composite on the palette at one time, as long as it's as you make the decisions about what you want to use at the beginning of treatment, put your materials out, small amounts, large amounts depending on what you need, and taking one shade or the other from the pad takes no longer than it does to take one shade or to use a compule directly in the mouth. You have quick, easy access, and the idea of using more than one shade then becomes reasonable to do in a reasonable amount of time. Good luck, and I hope this helps.